tech, there's changes happening where the flavor of health tech I want to talk about that's relevant for you in the audience today is about how a lot of the health tech being developed is going direct to the consumer, bypassing the traditional centers like the hospitals, the doctors, being developed by people who are not even doctors or software engineers, but even by patients themselves. So I want to start off with this big shift that's happening that technology is driving is the fact that actually we're moving from this 20th century system of system-centered care, where healthcare is all catered around the needs of the system itself, the institutions, the professionals, to a world where we're moving towards person-centered care, where actually the patient, their families, their caregivers are right at the center of these new systems. So that's a big shift that's happening, and started in California in the US. It's happening all around the world, enabled by technology. And so one of the things that needs to change is that in the 20th century, people went to the hospital, they had an episodic illness, they had an infection, they were treated, they went home. That model isn't sustainable. So we're moving to an era of self-care, where people living with long-term conditions like diabetes, hypertension, heart disease, those people are now being given technology to help them manage their disease themselves at home in between visits to the doctor, because again, that's one of the ways we're going to make healthcare sustainable. We're not going to go bankrupt in terms of our economies by using these new technologies. Now, one of the really interesting things is that these tech companies, whether it's Facebook, Apple, Google, all of them, even the Chinese ones like Alibaba, Tencent, they're all getting involved with healthcare and saying healthcare is this huge industry around the world, and we can come in and disrupt it with our technology. We've done it in other areas, we can come into healthcare now. So they're really trying to stimulate a new era of innovation. And it's starting already in terms of the innovation, but there's cultural resistance, right? Because healthcare is a very complex industry. There's a lot at stake. If you get something wrong in your algorithm, somebody won't just dislike your app and give it a 1-star rating. They may die. That's huge, right? So this was just simply, this is a GP at hand, a video calling service on an app that was designed to make access to a GP in the UK easier, but it was met with resistance by doctors saying, we're going to take this service to court because they felt threatened by this new idea, this new innovation. So you've got to be prepared. Anything you do in health tech, you've got to do it for the long haul. You're going to get a lot of resistance to this new ideas, the change that you're putting forward. You're going to have to be tenacious. Now, again, from a global perspective, I want you to think about the fact that the previous example, they were trying to increase access to GPs with a video calling app. Think about it from a global perspective, this shortage of health workers, nurses, not even doctors, but nurses around the world, especially in poorer countries. That's who you've got to think about when you're developing these new ideas here in Vienna today and beyond. So this is something that's come out of India, but it's used globally. A friend of mine, Joe Agarwal, set it up, and it's called Visa, and it's a compassionate AI chatbot. And so it's, out of all that I've tested, it's one of the most human-like to talk to. So you're chatting, you share your symptoms when you're feeling down, it asks you what's wrong, it tries to coach you. Now, she shared a story of how powerful this application is, just a simple chatbot powered by AI. She said a 13-year-old girl living with depression wrote into her and said, I was on the verge of taking my own life. The only thing that kept me from taking my own life was this penguin, was this chatbot. It's artificial, right? It stopped this girl from taking her own life. When you think about the people around the world that are contemplating taking their own life, they can't necessarily access healthcare services. Maybe they don't want to turn to a human being because they think the human being is going to judge them when they're vulnerable. And maybe they're going to turn to an app like Visa or something that you maybe are going to build in the future. And again, globally, I want you to think of the huge unmet need. So these two charts illustrate, so today we have 7.5 billion people on this planet. By the middle of this century, forecast to be almost 10 billion. By the end of this century, 11 billion people on this planet. So we already have this shortage of health workers. Think how bad it's going to get, how they're going to need new products and services to access care. And already in London, things are changing. For example, some hospitals are trialing the use of AI to not necessarily replace doctors and nurses, but some of the things they do which are administrative, to free up their time to care for patients by saying we're going to try and use AI. So again, huge changes coming on board, which is changing how medicine is practiced, how healthcare is delivered. And again, going back to the global perspective, things are happening even in Africa. This is Nigeria. It's a startup called Ubenwa. And so there at the moment, a lot of babies who are born lose their lives very early on, and there's something called asphyxia, and they die early on, and it's not detected early enough because the technology is expensive, complicated. So what this person has done, he's Nigerian, he's actually built an app using machine learning that detects the baby's cry when it's born and can detect that condition and tell the health worker you need to take some action, all using machine learning, listening to that baby's cry. Think how powerful that is. That's something you could get involved in tomorrow, right here from Vienna. As in, it doesn't necessarily need to be Nigeria, it could be somewhere else. Now, the other thing that's scaring a lot of people generally, how many people are concerned about the impact of artificial intelligence in their careers? You're just starting out here. Put your hands if you're worried about AI in your lifetime. A few of you. But a lot of the people, accountants, doctors, lawyers, middle-class professionals are now worried, whoa, well, how much longer of a career will I have? So this interesting research was asking all these world's AI experts, when will various human tasks be automated, surpassed by AI? And what's interesting about this research is they said, writing high school essays by 2026, AI will surpass any human being. But what I found really interesting, working as a surgeon by 2053, middle of this century. Again, these are just estimates, but these are these AI experts. On top of that, they believe that within 120 years, all human jobs could be automated by AI. So what does that mean for our future again? There are challenging times ahead. But again, when it comes to our health, when we're sick, when we're vulnerable, when we're lonely, when we need help, we can't just rely upon the tech. It's medicine, healthcare, it requires that human touch, eye contact, human touch. How would you feel if, receiving a diagnosis via a chatbot on Facebook Messenger, right? I'm sure most of you wouldn't want that to happen. You want a human being to look you in the eye, to tell you what's wrong and how to move forwards. But again, AI can be very powerful in ways that we don't even imagine. Going back to mental health and people looking to take their own life. So in China with Weibo, they're scanning people's posts and using AI to determine who's putting out content which is suggesting that they're possibly looking at taking their own life, and then to intervene, right? And then they're doing the same with Facebook around the world, apart from the EU, where our new data privacy laws prevent Facebook from rolling out that tool that's going to monitor people's posts and see if they've got anything about suicidal ideation and then flag it up. So again, think about the context that we operate in. Certain things are not available around the world because of the laws that we have. And again, what kind of future do we want to build when it comes to health tech? This is a survey in the UK that found 41% of those workers surveyed said they'd be willing to wear a device that would allow their employer to monitor them whilst they're at work for early signs of a mental health condition. How does that make you feel, this world where you go to work, you start your job, and your employer is monitoring to see whether you're getting early signs of anxiety or depression or a panic attack? So this is the kind of balance we need to think about when we're building this health tech. How many people are looking to go for a drink tonight to celebrate this conference and all the energy and the new ideas? So this is a company that's building a prototype where you'll wear this bracelet and it will track your alcohol intake in real time. So we're talking about maybe your girlfriend, your boyfriend, your parents, your doctor in the future. At next year's Entrepreneurship Avenue, you might be getting these bracelets and people can track how much you're drinking. Cool or not cool? And then it's even getting into tablets, medicines themselves. So there's a company called Proteus Digital Health. So they've actually, this is now legally approved in the US. So they've actually put a chip inside the tablet itself. You know why? Because there's a big problem around the world, people not taking their medication, right? People's symptoms getting worse, they're admitted to hospital, it's a huge cost. huge problem for people. So this company's saying, let's put a chip inside the pill. When you take the pill, we get a signal, and up in the cloud, we know that you've taken your medication. But people are worried, are we heading towards some kind of biomedical big brother? Is this the kind of health tech that you want to be a part of? And actually, there's now even sort of drugs as software, this new era of digital therapeutics. So people building apps that are actually being used to prevent disease, i.e. maybe to prevent the onset of diabetes, or prevent the onset of heart disease, or prevent the onset of depression, just purely as software, as an app, potentially. So this is a huge new area for you to look into, digital therapeutics. But again, the path's not going to be straightforward. So there are changes happening all around the world where policymakers and many members of society are saying, wait a minute, all this AI, this black box, this algorithms that people are developing, startups are putting out there, we don't know what happens when things go wrong, who gets held accountable. We don't have a legal framework, an ethical framework. Is this even moral to use this? Who benefits from these algorithms in healthcare? Is it only the rich people who can afford the AI? Or is it actually AI gets given to people who are poor, and only the rich can afford to see a human doctor in the future, right? So really interesting reports for you to go and read, one by the EU, another one by Future Advocacy, to look at all these challenges and to discuss them. And then again, when it comes to trust, whatever you're going to build in health tech, it's important that you start with trust from the beginning, with transparency. You don't end up like Facebook and Cambridge Analytica trying to misuse people's data without getting their consent. And again, even Facebook, they've now backtracked. They were having secret plans in the US. Let's try and get hospitals to share patient data with us. They had good intentions, but again, it was a secret mission. Conversational UI, so things like Amazon Echo, Google Home, all these smart speakers coming into our home with microphones, monitoring our voice, understanding what we need, understanding our behavior. How many people have got an Amazon Echo at home? A few of you? So we're going to see what Alexa offers some advice today. So let's see. Alexa, what suggestions do you have for the students in the audience?
Sorry, okay. I'm not sure.
Is the mic on? Alexa, any suggestions for the students in the audience?
I'm so excited to be at Entrepreneurship Avenue. Follow Maneesh's advice. Dream big. Build a health tech startup in the coffee break.
So we can see Alexa is completely in sync with this talk. Okay. Now, again, I mentioned about the innovation, where it's coming from. So this is an example of patient-led innovation, where patients themselves, they're not even waiting for entrepreneurs to build something. They're not waiting for the system to approve something and take 10 years to give them a new tool. This is an example of a chap called Roland in the Netherlands. He's living with Crohn's disease, and he wants to manage his health in between visits to the doctor. So he's going and building a chatbot for people living with Crohn's disease, his own community. So this is what's scaring the healthcare system, that actually this democratization of technology around the world means that anybody can just build a tool for themselves now. And that is a huge change. This is an example of students building things, so people like you going out there. These are winners of Microsoft's Imagine Cup last year, so they're from the Czech Republic. These students built a cloud-connected blood glucose monitor for children living with diabetes. So again, this has come from the Czech Republic. They won it, not from America, not from the UK, not from China, but from the Czech Republic. This is another example of students, but this is where they're collaborating. So this was at University of Pennsylvania. They have an annual mHealth Challenge, and these students came together from the nursing school, from the information systems school, from the behavioral health school, to come together and create something around a specific problem in terms of an app. And this is a brilliant example in China, where in China, these students built a stair climbing wheelchair for his grandparents in China. So again, think of what's possible in today's world, and where innovation is coming from. This is another brilliant example at the University of Manchester in England. These students built a prosthetic arm with 3D printing. Now, currently, if you buy these advanced arms, they're £25,000 minimum. These students built it for £307, and they aim to get it lower. So again, I want you to think about the possibilities. The tools are out there to help you build solutions. What can you do? This is what students have already done. However, it's not as straightforward as just going in and saying, let's digitize healthcare, because one of the problems is companies, healthcare systems, hospitals are spending millions and millions of euros, and they're digitizing existing processes, but the existing processes are crap. And all that happens is you've got this digital layer on top, it's new and shiny, but the experience is still a crappy experience. So I want you to think about design thinking, how you get involved with designers, human-centered design. And this is a lesson for you all. How many people have heard of Theranos and this blood testing startup? There's this new book that just got published. Amazing to read it. I was reading it on the plane over because it's a lesson in how not to do a health tech startup. She was billed as the next Steve Jobs. She had a startup valued at around $9 or $10 billion. Now, she'd just been charged in the US with raising $700 million based upon fraud. The science was basically shady, it wasn't robust, and the claims that she was making were false. She actually got personally fined $500,000 as well, and she can't hold a company now, a directorship for 10 years, I believe. So that's how not to do a health tech startup. So this is another example. This is again in the US, but this is a company called Lumosity. And you may have, if you've got grandparents or aging relatives who've maybe played word games on their iPad, believing, oh, maybe this will prevent me getting from Alzheimer's, etc., prevent my brain from getting worse. Now, one company went out there and made claims that their game on the iPad would actually prevent cognitive decline, and those claims were unsubstantiated, they were false, and they got fined $2 million in the US. So again, be careful if you're making claims in the health tech space. Now, going back to Austria, you have a lot to be proud of here in Austria and in Vienna. So this is Karl Landsteiner. Over 100 years ago, he's the first to discover blood groups. That led to then in 1907, people being able to do the first successful blood transfusion in the world in New York. And then he also discovered a few years later the polio virus. So you've got a heritage of innovation in medicine, in healthcare, right here in Austria. On top of that, there was this recent meeting in Vienna, and they're talking about putting the patient at the heart of the healthcare system, listening to what patients want. When you're building something, don't just build it because you think it's cool. Go out there, find real patients, find doctors, go to nursing homes, ask people what their problems are, their pain points. What can you do to help with your new skills, your new ideas? And this is a brilliant example directly from here in Vienna. I believe they started at the Pioneers Festival in 2012. But this startup, My Sugar, they're actually living with diabetes. They developed a technical solution, an app, to help people living with diabetes manage their illness. And they've ended up 6 or 7 years later, in 2017, being acquired by Roche Pharmaceuticals, a Swiss company, for over $100 million. So this is proof here that people in Vienna can build a health tech startup and you can go global. You don't have to move to Silicon Valley. You don't even have to move to London or Berlin. You can do it right here in Vienna. This is me a couple of weeks ago. I never imagined that I would be going to the UN in Geneva and being part of a meeting called AI for Global Good. Part of the health track was, how can we use AI to deliver universal healthcare to 1 billion people? So imagine these conversations that you too can be a part of. So I want you to find your tribe at this conference today in the coffee break. Follow Alexa's instructions. Find your tribe, because that's what's helped me in my journey. You've got to collaborate. Don't just stick with people who think like you or are in the same school as you. Speak to as many different people as possible. And again, you have to focus on those solutions which are going to be inclusive in society, not just for the rich who can afford a €1,000 smartphone. And again, you've got to think about humanity. Think of the population of the world, how it's growing, how they will need you. They will need your ideas. What are you going to do to rise up to that challenge? And here we are in Vienna, where Sigmund Freud, it's the city of dreams. I want you to be bold and be brave and follow your dreams. Thank you.
Thank you very much. A very brave move with Alexa. Now let's see, we have Slido, and let's see what kind of questions we have. Will robots be able to treat mental health problems? That's an interesting question.
You want me to answer that one?
Oh, yes, please.
Okay. So there's actually a survey from Ericsson. They did consumer trends a couple of years ago. They asked smartphone users in 13 cities around the world about AI and whether they prefer an AI medical advisor. What was fascinating is that challenging our assumptions that for mental health we'd always want to see a human being, right, because it's such a sensitive issue. They found something like 30% of those people in the survey around the world said for sensitive issues like that, they would prefer to share their symptoms with an AI medical advisor. So again, even doctors I speak to, I'm like, well, how do you know all of your patients always want to see a human being? What if there are some people out there that are not seeking care, especially men? They don't talk to anyone about this, and maybe the only person they would feel comfortable opening up to is a machine that seems to care, like Visa, right?
Great answer. Now here's an interesting question also saying, if there's an accident within a surgery where intelligent machines are operating, whose fault is it? The doctors, the engineers, the managements? Probably we can stand here as well, it's probably more light.
This is a really good question. So at the moment, this is a gray area legally, and this is what is being discussed right now. So if you're going to come up with anything that is in any way working in health tech, even if it's not in a hospital, but it may be used by somebody who goes to the hospital and visits their doctor. But going back to this specific example, so this is still to be ironed out. We don't yet know. And the challenge is that at the moment it's almost like a wild, wild west space where governments, regulators, authorities, they don't want to stifle innovation from people like you by over-regulating this space and saying it can only be this, this, and this. So at the moment, there's a balance, but it's going to be some experimentation. There's going to be some failures. There's going to be some mistakes. But it's up to you again to walk into this area with open eyes and understand the ramifications of what you do.
Here's also interesting. How do we ensure ethical treatment of data on such a sensitive matter when software is not open source?
That's interesting. So there's a movement out of Barcelona called the Decode Project. And what they're looking to do at a citywide level, because you've got smart cities initiatives, is to try and find a new model where citizens in a city can actually have full control over how their data are collected, how they're used, and to influence that pathway. So that's what's not happening at the moment, hence you see all these unethical uses of our data because they own it and control it. So there are certain places around the world that are trying to experiment. So it may be that one of you comes up with a new model in healthcare where maybe even patients sell their medical data from these apps, etc., and these wearables directly to the pharmaceutical industry or the healthcare system itself. So some people are experimenting here.
Now, Anonymous wants to know, not those Anonymous, but someone else, why do you think so far into the future, while not even the US has a working healthcare system?
Because we can't look to the US for inspiration, right? Those guys have messed up, they're doing it completely wrong, they're spending all that money compared to Western Europe, and still they have worse outcomes than parts of Europe. So, but it's a question of I believe here in Europe, we still have to pursue this vision of being inclusive, of actually serving everyone's needs. If we follow the US system, where we only go for the people who are rich, that's not going to work here in Europe. We have to think of everyone's needs. And again, we have to think of low-cost innovations. We have to think of what students can come up with.
Here's a question I'd like to ask. With technology developing faster and faster, how can lawmakers stay ahead of technology and with the future?
Gosh, they could come here and speak to you and see what you're thinking of building. But are there any lawmakers in the audience who've come here?
Oh, there's one.
There's one, great.
A brave one, yes.
Yeah.
Probably more.
Yeah. But I think it's more civic engagement, more public engagement. So back in the UK, there's more and more policymakers and lawmakers are saying we need to engage the general public. They need to understand, so we need to have the whole population, or as many people, understanding what are these implications. Because you may think, well, who cares about AI? I basically stack shelves in a supermarket, but it will have implications, if not for you, for your children, for your grandchildren. So everybody needs to get involved in this discussion, and that way the lawmakers can be influenced.
Maybe this question keeps popping up. Validation, how long does it take for apps?
Sometimes no time. So there's something like hundreds of thousands of health apps out there. And I use the word health apps lightly, from meditation apps that you could develop in a hackathon here, right through to apps which are certified and regulated. They've gone through clinical trials, so there's a wide mixture. So there is no hard and fast rule, but when it comes to validation, one thing I want to say explicitly is when it comes to building a health tech app, one of the metrics that most people use in a startup is say, right, I've got 10,000 users, my app has been validated. That doesn't work in health tech. You can't say, I've got 15,000 people using my mental health app, that's the validation. Especially if you're going to be using it with patients and impacting their health, you're going to need to interface with the system and say, what do you need in order for you to trust, as a doctor, this app or this wearable or something else I've developed?
Thank you very much. Now, we've run out of time. If you want to have a bit of a chit-chat with Maneesh, he'll be here for another 20 minutes in the Library Cafe, which is just around the corner, where you have an intimate fireside chat with him. So, Maneesh, it's been a pleasure. Thank you very much. Thank you. Right that way. Thank you very much. Right, okay, right that way. And now one last thing. We have a special announcement. Before we have the pause, we have a very special...